Hey everybody, thanks very much for joining me. Let me give you a brief update of some of what's going on in Washington from my perspective. You all know that Congress miraculously avoided a government shutdown despite the best wishes of some right-wing extremists who just don't believe in government. So we survived that bullet. We will see what happens in a month and a half. Clearly, there are enormous issues facing the country that we are not yet dealing with: income and wealth inequality, a corrupt political system, the fact that 60% of our people are living paycheck to paycheck, the fact that we have a child care crisis now, which is only going to get worse, and needless to say, we're dealing with the existential threat of climate change. Some of the issues that we are not dealing with, while some of our right-wing extremists want to shut down the government. But in the midst of all of that, I wanted to say a few words as chairman of the U.S. Senate Committee on Health, Education, Labor, and Pensions about the healthcare situation in America. And as I think all of you know, our healthcare system is basically broken. It is dysfunctional, and in fact, it's getting worse every single day. We spend, as a nation, almost twice as much per capita on healthcare as do the people of any other country. $13,000 for every man, woman, and child. That's unsustainable and quite unbelievable, and it is over 18% of our GDP. Yet, despite that huge expenditure, we remain the only major country not to guarantee health care to all as a human right, leaving 85 million people uninsured or underinsured. And it is my view, as I think all of you know, that I believe we should move toward a Medicare for all single-payer program, guaranteeing health care to every man, woman, child in this country as a human right. But we are not there now. 0 Republicans will support that, and probably half of Democrats won't support it as well. So that fight continues. But I'm not going to tell you that we're going to pass Medicare for all tomorrow. We are not. Despite our huge healthcare expenditures, one of the other factors that is really quite incredible is our life expectancy is actually getting lower. And incredibly, not only do we trail behind many other countries in how long we live, the gap between the rich and working families is now 10 years. In other words, if you are poor, if you're a working class person, on average, you're going to live 10 years less than people who have a lot of money. That is immoral. It is unacceptable. That is the reality today. In terms of prescription drugs, as I think you all know, we pay by far the highest prices in the world for prescription drugs. And every year, the pharmaceutical industry makes huge profits, pay their CEOs exorbitant compensation packages. And what is really nerve-wracking for me as the chairman of the committee is that many of the new drugs coming onto the market for cancer and for other diseases now cost over $200,000 a treatment. Yup, you heard that right. $200,000 a treatment. And as bad, and this is the area that I'm working on right now, as bad as our overall healthcare system is, our primary care system is even worse. Today, despite this huge expenditure of money, we have major shortages of doctors, nurses, mental health providers, dentists, and pharmacists. And those shortages will only grow as a result of the COVID burnout that many providers experienced and the aging of our healthcare workforce. And as a result of that, tens of millions of Americans, even those with decent health insurance, cannot find the medical care they need on a timely basis. And some Americans, going to wait months to see a doctor. Others living in rural areas have to travel incredibly long distances to find a doctor. This is the richest country in the history of the world. That's our healthcare system. So what are we trying to do about that? While we continue the fight for Medicare for all and a revamping of this entire broken system designed just to enrich the insurance companies and the drug companies, while we continue to work on that, right now, what I am focusing on as chairman of the Health, Education, and Labor Committee is primary care. Now, why am I doing that? A, because I can put together some bipartisan support on that. We passed just passed recently a major bill with every Democrat on the committee voting for it and 3 Republicans voting for it. That's a kind of big deal. And what does this bill do? What it says is that it is crazy that we don't have enough doctors and nurses and mental health providers. So we are putting a significant amount of money into a program called the National Health Service Corps, which will get young doctors and nurses and dentists to underserved areas by forgiving their debt. So we're going to grow the number of doctors and nurses and get them to the places that we need. We are also expanding a program called the Teaching Health Center Program, which allows residents, medical residents, to get their training in other than big urban hospital facilities. They can now train in community health centers, train at smaller hospitals, and get more involved in rural and urban health care and in primary care in general. And maybe most importantly, what we're doing here is making a 75% increase in funding, 75% increase over a 3-year period for community health centers. And what is a community health center? Well, community health centers exist in every state in the country. They provide affordable, depending on your income, affordable health care, dental care, mental health counseling, and lower cost prescription drugs. Over 30 million people around the country now utilize community health centers. This legislation would significantly expand that number. So, bottom line is, we have a major healthcare crisis. The entire system needs to be reformed. We don't have the votes to do that right now in Congress. The power of the insurance companies and the drug companies is just so great, so intimidating to many members of Congress, they can't stand up to them. That's just the fact. But what we can do right now is make a significant step forward in primary health care. And when you do that, by the way, you actually save money in the healthcare system. Because if people go to a doctor when they are sick, rather than getting sicker and sicker and ending up in an emergency room, which is very expensive, or a hospital, which is even more expensive, you save money. Keeping people healthy, disease prevention, treating kids in schools, which is what this bill does, saves money. So I wanted to give you an update of where we're at. We got the bill out of the Senate Health Education Labor Committee on a bipartisan basis. We're going to try to get it to the floor as soon as we can. And if we can pass this, it will not deal by any means with all of our healthcare problems, but it will be a significant step forward in providing healthcare to more people and lowering the cost of healthcare in America. Okay, thank you very much. Take care.